Okay, so I sort of was asked to sort of come on here and have a chat. I don't have any fancy slides, I'm sorry, and I don't have anything else to put up on the screen apart from my face. But I wanted to talk about the love I have for continuity, obviously, and what it means to me, and going forward, what it means to me. So the basics I wanted to talk about, because I think that's what a lot of people are interested in, like what are my basics, what is happening to me on a day-to-day basis. So I'm part of a team of 6. We started out as a continuity team last January, just before COVID hit. So we had a lovely clinical space in a children's centre, which unfortunately we lost within the first 3 months because it was shut due to COVID. So we made big adaptations almost straight away as a team. We were rotated to working days, and we had long days on call and night on calls. They are 8 in the morning till 8 at night, and vice versa. But with that, we have had to adjust those as well, because we found that having the strict days that were rotated didn't work for the women and didn't work for us. So we changed that and we became self-rostered. So in terms of my working week, I can have one long day where I'm on call for labour, and I go wherever the woman is, or I can have one night on call a week whereby I'm at home, and obviously I go out to wherever the woman is to care for her in labour. The rest of my days are what I want to do and what I need to do. So some weeks are very, very busy. I book 3 women a month, and I try to space those so that they're not all having babies in the same week. But as we all know, the magical due date doesn't really exist, and babies come whenever they want. So some weeks I can have a very high commitment to postnatal care, because I have 3 women that have their babies, so I'm going out to see them a lot. So some days are very full and some weeks are very full, and some less so. I wanted to sort of run through sort of maybe a bit of a day in the life. I read it out to my teenage son earlier on today, and he said, "That sounds really boring." And I was like, okay. It's like, thanks for the feedback. Beautiful. But then I just read it to my eldest son, and he was like, well, yeah, that's all right. That's what you do, isn't it? I thought, yeah, okay, we'll go with it then. So I'm just going to read out sort of an average day in the life of me and what I do. So it's a working day. I'm not on call for labour care, but I check my work phone for any overnight updates or day updates. I answer 3 text messages from my caseload. One is inquiring whether her partner can attend a scan, another checking that our appointment time is this morning, and the last asking whether I could give her information on hiring a birth pool. I wish my team a good day via work phone WhatsApp and pack my bag for the day. I have a mix of postnatal and antenatal appointments, so it's a good idea to check over equipment, stock and paperwork before I get out on the road. I arrive at the hospital to see a woman booking for her first pregnancy. I check my phone, and again there are messages from the caseload inquiring about blood results and one asking about newborn behaviours. The booking goes well as I explain the team care and the expectations of continuity of care. I complete paperwork and take booking bloods. I then see antenatal women till 12, and it's great to see they're all going well in their pregnancies. Before I leave, I check my inbox and reply to an email about a consultant appointment I had requested for a woman. I add appointments to my work calendar for the next few days. I head out on the road after a sandwich and a fizzy drink to see my postnatal women. It's wonderful to support the women in their feeding choices and seeing their first few days as new mothers when you've cared for them throughout their pregnancy. It is then time to get back to the hospital. I get my NNST samples checked by a colleague, check the intro for any referrals. I remember that I need more blood forms to do a 28-week check, and so I print them off. The admin team in the office take a call, and they ask me to speak to a woman and reassure her about her baby's umbilical cord, and I give reassurance plus signposting. My teammate is in the office as she's working the long day and has been called in. She describes the lovely birth she has attended. I check she doesn't need any help, as I can do the NIPE examination. She's already organised it, so I bid her farewell. I arrive home and I check my work phone again, a few more texts to send and signpost into triage for a woman that has concerns that her waters are broken. I log on my laptop and cash up the morning's appointments while adding future appointments. I remember that my e-learning for resus needs redoing, so I do the reading and assessment. It's the end of the day and I check in on the day's events in the team via WhatsApp and make the night on call midwife aware that a caseload woman may be attending triage for a query SROM. I then turn off the phone as it's the end of my day. So it probably does sound a bit boring, but I thought it, just lay out the basics. I wanted to say about continuity that I really feel it's a lived and a loved experience. In that, I mean, the lived experience can be really challenging. It is learning to adapt. It's a totally different model of care. If you've been a rotational midwife, then this is a big change for you. To take on a caseload, to be an autonomous practitioner, making care plans and following through those plans, it can be really tough in the beginning. And then, you learn, you adapt, you learn how to time manage better. In some cases you don't, because we're all human. The lived experience of sort of having a team and building a team is really great. I've loved it. Building the connections between the team and having really good team leader has made the experience for me. The loved experience I talk about, and I grin from ear to ear, and I tell everybody that ask me about continuity, is the love, and I do mean sort of hearts, but the love that the women give me and talk the way they talk to me, and we see it in sort of evaluations and the feedback forms and things like that. But the way that the relational continuity, the actual connections with women, is what I became a midwife for. And I feel that's what I'm having in my job role now. So that's what I call sort of continuity, lived and loved. Going forward, there's still a lot to do. There's still stuff that I want to do as a continuity midwife. I want to improve in more outcomes. I want to do better, and that's what I strive to do. In terms of the team, we've changed. We've adapted, as I said. We're now a mixed risk caseload, whereas at the beginning we were taking on only low risk women. We are postcode specific now, which was quite a big change, because we were sort of dotted around an area rather than being in one area and seeing what impact we could have on one area. And sort of my own sort of responsibility wise, I feel like I really want to look into how we are sort of reducing the use of epidural, and how we are sort of like helping our women to stay at home when they're in their latent phase, and coming into hospital when they're in established labour, and in getting more women to have home birth as well. I've had some beautiful home births with the team, and women having their first baby at home is absolutely, is a dream. It's an absolute dream to be with them and support them when they do that. So that's really me. I don't really have much more to say other than I love it, and I encourage people to do it. Step out of their comfort zone, think about the bigger picture. What you came to be a midwife, why did you want to do it? And if that drives there, then go for it. You won't be disappointed in sort of the way that it works. So that's me. Thank you for listening, and obviously I'm open to questions. Anyone wants to ask me anything at the end of the session.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.